Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, prognostic factors of the breast carcinoma. In the prognostic factors of the breast carcinoma, the most important prognostic factor is tumor staging. So tumor staging is the most important prognostic factor. If you were asked what is the most important prognostic factor or prognostic indicator for tumor which is localized to the breast, if tumor is localized to the breast, then most important prognostic factor is lymph node status. But in case of metastasis, then the prognosis does not depend upon lymph node status. If there is metastasis, the prognosis does not depend on lymph node status. Then what does it depend on? So if in case of metastasis, the prognostic factors will mainly depend on, or prognosis is dependent on ER and PR status. Then the prognostic markers, there are some prognostic markers which are associated with poor prognosis. The prognostic markers associated with poor prognosis are PCNA, Ki67, BCL2, BAX, vascular endothelial growth factor, HER2 new, epithelial growth factor receptor expressions. All these are associated with poor prognosis. Then
thank you and thank you for watching.